Hi everybody, my name's Livsey. I'm a registered adult nurse and the director of Complex Care Professionals Limited, which is a domiciliary care company, and we provide care in patients' own homes. So my journey in a snapshot, I qualified in 2005 at the University of Manchester as an adult nurse. I didn't plan on going in social care, as way back then, as I think Melissa touched on it, it was seen as a place to go for retirement, and the in place to be was the NHS. My friend was a registered manager for a big domiciliary care company that did adult social care, and asked me to go in a day a week to interview nurses because she had no nurse to interview. So I actually fell in it by default. I'd been in the NHS 5 years by then, and I just did a day a week, and I absolutely loved it. And it came to a point where I couldn't do a day a week there and full time for the NHS. And I was offered a full time position, and I left the NHS, went in the private sector. And to be honest, I never actually looked back. I just discovered, I had a real passion for it, and I just absolutely loved it. I went on then to work my way up from branch manager, operations manager, where I eventually opened my own company in 2019. So for me, as my slide says, I didn't leave nursing. I evolved and, became a different version of a nurse than what I was in the NHS. A lot of stigma around social care, which I actually fought myself when I joined it many moons ago, that, I would de-skill, that there's no clinical. It was making Betty a cup of tea and hoovering up, which is not the case at all. We look after probably more clinical, complex stuff in the community now than ever before. I mean, my agency does ventilation, non-invasive vent, tracheostomies, spinal patients, manual evacuation, intermittent catheterization, complex medication regimes. We're just involved in a lot of stuff. There's a lot of patients that are just at home, and some come with conditions that we've never even heard of, that we have to research and get our staff trained up into, and ourselves. There's more and more people now choosing to be at home with complex conditions. Some of our patients, when they need to attend hospital, my staff have to go in with them because the hospital staff aren't trained to look after them clinically. So that, the stigma around it's not clinical is not true. Some of the safeguardings that we get involved in are really complex. We work very close with multidisciplinary teams. We speak daily with GPs, district nurses, OTs, physios, discharge planning on complex patients, coordinating it. There is a hell of a lot. It's a big, beefy role that's in it. So you don't lose any skills. You gain a lot of leadership, management skills. There is a lot going on. So my career growth, as I touched on before, I was a branch nurse, and then I grew to a registered manager. Then I became an operation manager. I was leading 9,000 hours of complex care delivery for my previous company before I opened my own. I opened 5 branches and oversaw all of them, including compliance, governance, a bit of everything. The registered managers I looked after. Then I opened my own company in 2019. I've since opened 3 locations. I have a clinical nurse manager that works underneath me. We have another nurse that's joining us on Monday. One of my nurses has just left, and we're recruiting for 2 more nurses at the moment. So we are very much a nurse-led agency. And I think the way social care has gone, I mean, a lot of our patients are CHC funded, so they all have a health need. We do a lot of work with crisis response and hospital at home, which is preventing hospital admissions. So when somebody's acutely unwell and would normally go into hospital, we manage it and we go in alongside crisis response, usually for a 2-week period. So yeah, you do learn a lot of clinical leadership and things that you wouldn't think that you would learn. So why does this sector need nurses? I believe because of the way the complex patients now are nursed at home, there's more and more people choosing to live at home. Sorry, not live at home, be nursed at home, looked after at home. The hospitals, it's all over the news. They can't keep up with the demand. There's a shortage of staff everywhere. And I think that the more and more complex patients that come, we need nurses to lead the way. I've got 170 care staff that need overseeing by nurses. The nurses do the competencies, the training, the medication audits, physical observations. They do an awful lot. So I think we're shaping the way and we're influencing how care is delivered in the community. And I think it's a really exciting time to be in social care. So my final words, sorry if I've rushed as well, I am quite a nervous speaker. Social care is not a backup plan, it's a bold career choice. Don't think, oh, it's social care, it's where you go to retire. That's not the case. Explore it, don't overlook it. Lead it, don't follow outdated assumptions. I was guilty of that when I was newly qualified. I just was obsessed with getting into the NHS. That's not the case. I loved it and I did fall into it by default. And if I could do it all again, I certainly would, but I'd go in a lot sooner. Thank you.
Thanks ever so much, Lisa. That was really informative and really good to get your personal take on that as well, and how you grew. So that was really great to hear.